Okay, so guys, I'm going to go over week 4. It looks like knowledge check 2 and maybe 3. Let's see what we can do. So I'm going to go down. If you look over here, you can see that I'm on the same screen you guys have week 1. Find it. Where the heck did it go? Bida bong, bida bong, bida bong. And we're going to scroll down here. We're going to find week 4. Week 4 learning outcomes, week 4 knowledge check 2. It's about the heart. Okay, so we're going to check through that one real quick. I'm going to open it in a little another window, and I'm open the other one too, week 4, that one. Knowledge check 2 in there, and we're going to look up all one. Now, knowledge check 1, if we look at these, or knowledge check 2, sorry, knowledge check 2. Week 4, knowledge check 2, right there. Few questions, not terrible. The heart can be confusing. And one of the things we want to watch out for the heart is to not get stuck up with so much of the details, because remember, this is supposed to be a basic class. So there's a few things we want to know about the heart. The heart is, more on the left side. It's a pump that has 4 chambers, has 2 ventricles and 2 atria. Okay, so we're going to look at the first question here. How many chambers does the human heart have? It has 4, and we're going to go down through the next one, and that's good for that one. If you want to follow along and redo yours, you're certainly welcome to. I mean, you're going to go through here. It's going to give you a bunch of information. Blah 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 blah. It tells you everything that's going on. This one here is going to. Why did it knowledge check 3 already? That's weird. Let's go back. See if I can find. Let's check 4. Need the blood. We should have the rest of our stuff in here. There should be more questions. 1 second. Let's go through there. There's the next question. 4. Okay, good. Oh, there we go. So it has to wait. So we have to wait. I'm not, geez, terrible one. Which chamber of the heart receives oxygen from the lungs? So remember, it goes from the left side, okay, atrium, to the left ventricle. From the left ventricle to the body out the aorta. Then it goes through the whole body, drops off some oxygen right about here, picks up some CO2, comes all the way back, goes in through the vena cava, which is on the right side, right atrium, and then the right ventricle. Right ventricle sends to the lungs. The lungs send back to the left ventricle. Okay, so we're going to look at this one. It's going to be the left atrium in this one. Which chamber of the heart receives oxygenated blood from the lungs? Lungs, left atrium. Now, oxygenated means it's dropped off CO2, picked up oxygen so it can distribute it through the body, attached to red blood cells or erythrocytes. Okay, which blood vessels carry oxygen poor blood from the body back to the heart? And that's going to be the big guy. It's a big one, huge one, vena cava. The vena cava is on the right, and the aorta is on the left as it comes down through the chest, through the diaphragm, actually. So it leaves the heart up here, and the aorta makes a little loop-de-loop, and it goes down the left side of the body and then branches all over the place to bring blood to the different organs. It goes through the diaphragm. Remember, the diaphragm is in through here. That right there. The diaphragm is through here, and it's a dome-shaped muscle that has 3 holes in it. 1 hole for the vena cava, that's on the right side. 1 hole for the aorta on the left side, bringing blood away from the heart, and the esophagus from the stomach, because the stomach is underneath this stuff, right? So let's see. The heart muscle is also known as the. See, this is a trick one, because cardium means heart. Pericardium means around. Peri, right? Perimeter, around the heart. Endocardium means inside the heart, and myo means muscle. So this one's got to be a muscle, right? The next one, let's see what it says here. What valve is located between the left atrium and the left ventricle? Well, it's going to be the left valve, but it has a name. Okay, the left valve is called the mitral valve. Now this one here, or bicuspid. Bicuspid means it has 2 parts, right, like this. Now I just had mine checked out. Mine has a problem with this because it has 2 little leaflets. It has one in the front and one in the back, like this. And when blood goes through, it goes through one way, and then these little strings down here hold it, and then it lets go and comes back like this. So blood can't come back into that left atrium. Right, it goes from left atrium into left ventricle, and then it's going to go out through the aorta. right? There's another valve there. But what mine does is mine does this, and then it goes, right? There's a little floppy bit in there. So that's a mitral valve regurgitation. It's also called a murmur. A lot of people have it. You can hear it. You listen down through here with a stethoscope. One of these guys. Can you have one of these guys? You listen right there, and you can hear huh, huh, or whoosh, whoosh, something like that. That's a murmur. Okay. Sometimes can be terrible, but usually not. I might have to get mine fixed. We'll see. Mitral valve, bicuspid valve. Bicuspid means two. There's a tricuspid, which has three parts, right? How many times does the average human heart beats per minute? Now you can do your own. This one here, and it's average, 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 average. Mine beats lower because I'm medicine, and it makes it lower, 70 to 90 times a minute. Usually around 60. If you check yours, and the best way to check it is through here. There's a carotid artery right in through here, and you just hold that sucker, and you should feel it push, 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 and you count those number of pushes for the count of 15 seconds as you look at a clock. All right, look at a clock, count to 15 seconds, and then you multiply by 4. Okay, you can do it longer and do multiply by 3 or whatever. Okay, which part of the heart is responsible for generating its electrical rhythm? Now, not the aorta. Aorta is the big tube leaving the heart. Okay, not the septum. Septum is the separator between the right and left sides of the heart. Like this is a septum right there, and that separates the right from left nostrils. And left ventricles is a lot of pumping that pumps out through to the body, but it is the SA node, sinoatrial node. So it's a little node. It's a little bit of nerve tissue that starts the pumping. Now you can take out the heart and it still beats about 40 times a minute by itself. It's a weird thing. Why would you take someone's heart out? But they used to. What is the primary function of the heart? Pump blood through the body? Yes. Produce oxygen. Does not produce oxygen. Filter toxins. Does not filter toxins. That's going to be the liver. Okay. And produce blood cells. That's the bone marrow. So now we have those ones in here. Pump blood throughout the body. That is its main function, right? Second one, produce oxygen. No. Does not produce oxygen. Let's see what it's going to do next. What's it? The heart's natural pacemaker, different from the sinoatrial node, right? We have the, actually it is the, yes, same thing, sinoatrial node. Now there's another node in there, the AV node, atrioventricular node, but this is the sinoatrial node, higher up in the heart. That starts it and then it goes down through the AV node. Node is the key. Node means like little lump of nerve tissue that has a timer. Thin wall of tissue that divides the heart into left and right sides, just like this one here. It separates. That's the key. The septum. Okay, there we go. It looks like we are done. 10 out of 10. See, if you followed me, you got 10 out of 10. That's a freaking great one. It was 8 minutes. Sorry about that, but I'm going to post this right now, and you guys are going to have knowledge check 2 completely done. You get an A on it. You see why. I'm going to do the other one in a minute.